A very warm welcome to all of you. So today I'm going to be taking my lecture in the Department of General Dentistry for diagnostic skills. So basically, I'm just going to be enlightening you about the importance of diagnosis, what an important role it plays on a day-to-day basis in the clinics, what are your responsibilities as a diagnostician, and we'll briefly just be discussing about the case history. So, what is diagnosis? It is, I'm sure you're all aware, it is nothing but the ability of the clinician to recognize or identify anything which is out of the ordinary, something which is abnormal, which is not supposed to be there. And you have the ability to find out and know what it is after conducting a series of tests or, after analyzing the situation. So basically, your diagnostic skills can be classified under two. They can be your investigative and they can be your analytical skills. Now, coming to your investigative skills, these are the kind of skills which you develop which help you to discover the names of the problems with which your patient is going to come to the clinic for. Okay, so basically, you can use your interrogatory skills, like you keep on asking your patient a series of questions, and then the answers which are given by your patient help you to arrive at a probable conclusion, not the final, of course, but maybe just the initial diagnosis. The descriptive skills, in which you yourself thoroughly examine the patient, the condition of the patient, the area of interest, and probably arrive at a probable diagnosis, followed by the various tests which you are going to be conducting to confirm your diagnosis. And the summative skills, this is just like a gist or a brief summary at the end of the problem, which says what you're dealing with and what has to be done and nothing more. So it's going to be precise and to the point. Your analytical skills is your assimilation of data. So you collect whatever data you can, probably from a known body of information. So you can either refer to, your textbooks. You can refer to articles, reputed journals. Even your lecturers, you go to them for info. Even validated sites on the internet, and then you decide what could be the most probable cause for your patient's problem. This skill, it has a drawback. So if you do not have enough information, or if you don't have access to enough information, you will not be able to arrive at a proper conclusion. So what do you have to do to get the information you need? So you have to do a lot of extensive research to actually arrive at your particular diagnosis. And once you arrive at your diagnosis, then you have to decide on what kind of treatment you have to take to get rid of the problem for the patient. Yeah. Okay, so how do you get started? So this, I'm sure you're all very familiar with, because this is what you've been doing in your clinics, even in the department of OMRs, ever since you've stepped in. So basically, you greet the patient, make the patient comfortable, and seat him on the dental chair. And then before you start off with your case history, you actually take the consent of the patient. That is, the patient signs on the consent form saying that the patient is aware that whatever treatment is going to be happening is going to be explained beforehand, and that the patient is on board. Yeah. So this consent is, of course, taken for medical legal reasons, so that later on the patient, if the patient has a change of mind, or the patient is unhappy, the patient cannot take any legal action against you, because everything would have been explained beforehand, which is of course our duty, and we are carrying out the treatment in an orderly fashion, and with nothing illegal going on. Yeah, so this is the best way for you to safeguard or protect yourself. Then followed by the chief complaint. So the patient actually tells or describes what is bothering the person. It can either be a single complaint or it can be multiple complaints. So you have to list it down in chronological order. So whatever bothers the patient the most is the priority, and followed by the various other complaints. This is followed by your history of presenting illness, wherein it is nothing but a brief description of each chief complaint. You ask about the duration, the nature, the severity, the extent, the location, the type of pain, so on and so forth. I'm sure you're all familiar with this. Then, of course, it is followed by a brief history, both medical and dental, followed by the examination. The examination, of course, starts with the extraoral, which is followed by the intraoral. The intraoral is divided into the hard and soft tissues, after which you examine the site of interest, and then you conduct a series of tests, clinical, radiological, histological, so on and so forth, until you arrive at a probable diagnosis. So after you arrive at diagnosis, the most suitable diagnosis, you form a treatment plan. So, House has classified the different kinds of patients which you can encounter in your practice. So, there are 4 classes. This is also going to be discussed in detail in the Department of Prosthodontics. So, the class 1 is the philosophical. So, they are among the best patients you can ever get. So they feel that whatever the doctor decides is going to be for their own good, so they just get on board with it immediately. So the prognosis is generally the best because they have total and utter faith in you. Yeah. The second is the exacting. So these people, they are the more educated kind, and they have a good set of reasoning skills within them. So they want to know, and they are very curious about whatever treatment is going to happen. So they're going to ask a lot of questions. So if you're patient enough to answer them and you're able to gain their trust, they are one of the best patients you can ever find for life, because they are going to be the best form of advertisement for you, and they're going to be loyal to you because they would have, satisfied their thirst for knowledge. They would have understood that yes, he knows his substance. The dentist, he or she knows his substance, his or her substance, and he or she is more than capable of solving my problems. Yeah. The class 3 is the hysterical. Sorry to say, but there are a few patients who actually walk in. They will never be happy no matter how good your treatment, and they're always going to be complaining. They they always have a sort of negative aura around them. So the prognosis isn't the best. So they'll never be truly satisfied with the work. And you have the indifferent. So these are the people who don't actually care about the dental treatment. They're here probably because somebody has actually forced them, or somebody has told them that you have to get this done, otherwise there's no other way about it, because of which they're forced to show up at the clinic, and they tend to give up easily. They don't really want to invest much time and money on their treatment. Now, coming to the case history. So, as you all know, the patient should be encouraged to tell his or her part of the story voluntarily. So, it's best not to interrupt the patient at every step, even though you may know what the patient is going to be saying. It's always best that the patient describes everything in his or her own words. This is even good for medical legal reasons, and also because at the end of the day, the patient also feels that the patient has been heard, the doctor has been very patient and kind, and uh, of course, you may have seen 10 to 15 patients in that day, but that patient might be seeing you for the first time. So you should not let that repetitiveness which you are facing be brought out in the form of frustration to the patient. So give the patient a chance to explain everything. Be a little patient. It won't harm you, and it will only do good for you. Okay. So the quality of the history is largely determined by the competence of the interviewer. So you should basically know what kind of questions you have to ask, uh, which sites to examine, and what kind of tests you have to, conduct, so that you are able to elicit the most, suitable case history. And this is, of course, also affected by the ability of the patient to communicate. So if the patient is not able to put down his problems in words, you're going to be facing a tough time. Yeah. Okay, so basically these are the most common complaints the patient walks into the clinic with. I'm sure you have seen all of them. A painful tooth, teeth which require cleaning to be done, missing teeth and the need for a replacement using a suitable prosthesis, cavities in the mouth, patient is not happy with the way he or she looks when he or she smiles, or maybe just a routine checkup. Yeah. And of course, the patient is standing in front of the mirror and, basically just looking around inside the oral cavity and suddenly sees a lesion. And the first thing that pops up in the mind is, oh my gosh, could this be cancer? So they are curious about it as well and scared. So these are the common complaints with which they present to your clinic. Now, there are three different types of questions, a format of questions you can use to, get proper answers. So you have the open-ended questions wherein you are leaving the patient a very broad space wherein the patient can actually give you a very detailed answer. So the best example is, can you tell me about the pain? So you are asking in just one question, you're asking about the nature, duration, onset, extent, the severity, everything. Yeah. A closed ended question would be, where you're restricting the patient to a particular type of area for the answer, like what does the pain feel like? So you're basically just asking about the nature of the pain. Yeah. And the leading question is where you just want a confirmatory yes or no answer. So you can ask, like, does the pain feel like an electric shock? So I'm assuming maybe the clinician in this case was, expecting a galvanism or, a galvanic shock probably in the patient. So now coming to the demographic data of the patient, I'm sure this is all very familiar to you because you are all taking detailed case histories in the Department of Oral Medicine and you're all doing a very good job at it. So you ask for all the personal data followed by the chief complaint, the history of presenting illness, a brief medical and drug history, the dental history, the family history, social history, and the personal history. So basically, you're just getting all sorts of information which you think could be relevant to certain findings in the patient, or if you feel that the patient has something contagious, whether you think it could have spread to the family or to his social life as well. And the social history, whether the patient actually has any habits like smoking or drinking, which can be a potential factor for the problem as well. Yeah. Then, of course, you have your extraoral and intraoral examinations. So, your extraoral examinations, you generally check for your lymph node enlargements, which indicate some sort of infection in that area. You can check the temporomandibular joint to see whether there is any clicking, or you can palpate and feel some kind of a swelling. You can check your facial symmetry to make sure whether there is any extraoral swelling or not, so on and so forth. And then, of course, your intraoral examination, you have your soft tissue and your hard tissue examination. So in the soft tissue, you have all, your mucosas, your gingiva, your lips, your frenal attachments. And in the hard tissue, it's, of course, dealing with your teeth, the teeth which are present, the teeth which are missing. Why are they missing? If the teeth are missing, in the case of, especially in the case of your wisdom teeth, are they unerupted or are they impacted? Whether the patient is wearing any dentures, whether the patient has dentures and has not brought them to the clinic, uh, what are the status of the existing teeth? Is there any wear? Like, are there any wasting diseases present, like attrition, abrasion? Are there any root stumps which show that the patient was careless enough to actually not go to the dentist for a very long time? Are there any fractured or discolored teeth? Are any of the existing teeth mobile? What is the occlusion of the patient? So on and so forth. And of course, you have your ICDA scoring to assess the caries risk also. The ICDA scoring to assess the severity of the caries in the patient's mouth. And then of course you do a caries risk assessment to categorize the patient into a high risk, moderate, or a low risk category, depending upon which you can suitably recall the patient, either biannually or maybe once every 3 months. And then of course, with all this information which you have gathered, you can formulate a provisional diagnosis. And then in order to confirm whether your diagnosis is correct or not, you can carry out a set of investigations. You can carry out radiographic, clinical, histopathological, and then after all the results are back, you formulate your final diagnosis. So basically, just before the final diagnosis, you can even have a differential diagnosis where you can have 2 or 3 in the case where you feel that this could also be a possibility. And then of course you're supposed to confirm it after with the help of the test which you carry out. So yeah, so this is what I was talking about: the provisional, the differential, and the final diagnosis. And so what makes a successful diagnostician? You should have good observation skills. So as soon as the patient walks in, you can start observing, because you can actually start seeing the gait as to whether the patient actually is suffering from any neuromuscular disorders, or whether the patient is in the right orientation. Sometimes even drunkards walk in. You should have proper listening skills. You should be patient as well, and you should be sharp. So even when you're noting down points and then the patient is talking, your ear should be wide open. You shouldn't lose focus. Maybe you should keep your mobile phones away. And not be busy chatting with your colleagues also when the patient is actually discussing something. You might miss out on some vital points. You should be courteous. This, of course, I'm proud to say that all of you are very, very courteous with your patients. I'm very happy with the way you speak to the patients and present yourselves in a very professional and friendly manner. Should be knowledgeable. This of course comes with experience, so it takes time. You have to keep on reading. Show interest in what you're doing. If you don't, the patient also will find it difficult to actually trust your judgment and your work. You should be intuitive. So you should keep on asking questions. You should be curious about everything. If we are carrying out some sort of treatment, why is this the best treatment? Why don't we try out the other treatment? So keep on having this curiosity inside you. Never stop asking questions, and always try to search for answers. And most of all, you should be patient. So if you're patient, and you let the patient, actually express himself or herself wholly, and disclose what is really troubling them. And sometimes when you feel that the treatment is not correct, you keep on trying to perfect yourself. It will all work out for the best, believe me. Yeah. So this was it for my lecture. If it's a very simple lecture. If there's any doubts, please feel free to contact me. I'm always available. Okay. So other than that, it's goodbye from my side. So take care, guys. Stay safe.